This is Dr. Andrew Young at the Center for Hip and Knee Replacement, and today we're going to talk about a specific aspect of robotic total knee replacement and the potential trap that it represents. So this is also another very technical discussion. It's mostly for healthcare providers, but you're welcome to follow along. So we're dealing with the specific situation when we are capturing numbers in flexion extension and we come across a very small number. Now in robotic knee replacement, we aim for an 18-18 flexion extension gap box. But sometimes we'll come across numbers that are big, but in this situation we're coming across numbers that are very small. And I'll show you what that means. Let's start with the radiographs. So we have three radiographs. We have an AP standing. We have a flexed view. This is a very good view that shows us the posterior aspect of the femur and tibial articulation. And then we have the lateral, and we can see we have tricompartmental disease, or what we call bone on bone, with lateral subluxation. We also have telefrontal disease, so clear tricompartmental disease. Okay, but this is the specific challenge in this knee using robotic knee replacement. So in robotics, we're typically aiming for 18 millimeter box, 18 millimeters in extension, 18 millimeters in flexion. But when we assess the balance at inflection around 90 degrees, we see we have very small numbers, 10 and 8. So there's a small asymmetry, but the big problem is this is nowhere close to 18. And so we call this a trap, because in order to get to 18, then you would be tempted to over resect an additional 8 millimeters of bone. And so that's something to be aware of. And in order to resect an additional 8 millimeters of bone, then you start making major changes anatomically. So if you were to resect more on the femur, then you would either over anteriorize your femur, or shift the femur too far anteriorly, or you would undersize, or you would lose too much posterior offset, which is back here. And if you are trying to make up the 8 millimeters on the tibial side, then you would take a tibial resection depth that is too deep. Okay, so this is the trap. You've got 10 and 8 in flexion. You are tempted to either move the femur anteriorly, or to downsize the component, or to drop the tibia. But don't do that. Right, you're going to over resect, and you're going to have too small a component. So in this situation, you'll have to switch to a measured resection technique. Now the numbers that you have are helpful, because you can at this stage restore symmetry to the flexion gap. So we see we have a 10-8, or we have a 10-9, and then we also have a 17-60. And there are two ways to correct this asymmetry in flexion. One, you can externally rotate the femur 1 degree, or because there's a 17-60 and a 10-9, you can put it in this spot, pin it, and then put 1 degree of varus. So you go from 0 to 1 degree of varus. And doing that, since you have the asymmetry in both extension and flexion, will fix both. And so now you are symmetric. Okay, so once you see these small numbers, avoid the temptation to over resect the femur, avoid the temptation to drop the tibia too low, just fix the angular deformity, and then we do the translational aspect, making sure we have sufficient space and flexion during the fine-tuning of the gap balancing. Okay, so now we start doing the fine-tuning. And again, remember, we are not going to be tempted to over resect, undersize, or anteriorize the femur, or drop the tibia too low. So first we'll make choices on the femoral side. So typically this starts at an 8. We have a neutral rotation. We don't want to over rotate. The main thing is we're maintaining our posterior offset. So we know that we have an undersized and that we're maintaining our posterior offset. We've advanced the femur by about 2.5 millimeters so that we can create a little bit more space. And then we've also made a choice to drop the tibia by 1 millimeter. So we're not talking about chasing 8 millimeters from 10 all the way to 18. We're dropping it 1 millimeter. But to preserve our extension gap, we've also dropped the femur 1 millimeter. So we're maintaining the space and the symmetry in the extension gap. Okay. Now once we've made those choices based on the mathematics of preserving symmetry and flexion and extension, once we've made the cuts, then we'll go do our fine-tuning using gap balancing techniques in both flexion and extension. So we first start in flexion. So we put our laminar spreader in, we look at the flex posture, and then we see that we're 19 and 17. So we're no longer dealing with 10 and 8. We are almost at a normal range, centering around 18, but we still have a 2 millimeter asymmetry between 19 and 17. We've already released the osteophytes. We've already done a posterior medial release. So in this situation now, we will do a gentle recession of the PCL origin off the femoral origin. Remember, the PCA is a secondary varus constraint, and so by releasing that, we can get another 2 millimeters. So now we can balance and we can get symmetry and flexion. Okay. So in the beginning, we got initial symmetry by putting 1 degree varus. We opened everything up. We decompressed the knee. We got an actual measurement with our laminar spreader and our spacer block. We still saw that there was a 2 millimeter discrepancy, so we'll do the fine tuning at the PCL. Our next step is to move into extension. Now that we've taken care of flexion, we move into extension. Now extension is actually pretty well taken care of. We're at 18-18. We've got a nice symmetric extension gap on both sides, but we are hyperextended at 3. And so in this situation, and so it's a good thing that we brought down our joint line when we dropped the tibia. So at this stage, what we'll do is that we'll switch this from a 9 millimeter insert to a 10 to an 11 millimeter insert to recreate the tension in the posterior capsule. And by doing so, we can maintain our 18-18, but now we're back to a neutral flexion. And so the postoperative radiographs show neutral alignment, symmetric extension gap, and on the lateral we can see appropriate anterior-posterior sizing with maintenance of posterior offset. And again, most importantly, we had those small flexion numbers. Those are considered traps because we've avoided over-resection of the tibia, and we've also avoided anteriorizing or undersizing the femur to open up that gap. So again, this is just a unique issue when we're dealing with robotic knee replacement as it relates to the Mako platform. Most of the time when you're capturing poses, you'll see anywhere between 17 to 20, and you'll be making just millimeter adjustments. And so you'll always be within the ballpark. But every now and then, you'll have a number that was way, way off. And at that point, it's very important not to follow the original heuristic, but to change tactics and switch to a measured resection. That will get you close, and then you can finish up with the fine tuning using a gap balancing technique. Thank you.